Okay. We're going to walk into the room. I'm going to be looking at your posture and your gait. And I'm going to provide privacy. I'm going to wash my hands. I'm going to introduce myself. Hi, I'm Helen. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Megan Aspinwall, December 19th, 1990.
Perfect. Let me look at your wristband real quick. Perfect. That's verified. That's 2 JCO methods of verification established. Okay, Megan, we are going to be doing a head-to-toe assessment today, okay? Megan is a 28-year-old Caucasian female. She's a 28-year-old Caucasian female. She is well-dressed. She is well-nourished. She is dressed appropriately for the weather. She has no visible signs of illness or distress. Her posture is erect. Her gait is steady. Megan, can you tell me what today's date is?
It's January 28th, 2019.
Perfect. And who is our president?
Trump.
Okay. And where are we currently?
Columbus Tech.
Perfect. Okay. Patient is alert and oriented ×3. Patient speaks English clearly and articulately. She is easy to understand. Cranial nerves 10 and 12 are intact. Patient walked in, greeted me with a smile, made eye contact, had no visible signs of illness or distress. Megan, can you rate your pain for me on a scale of 0 to 10 today? 0 is going to be no pain and 10 is going to be severe pain.
0.
Perfect. Okay, now we're going to move on to the head assessment. Before I palpate anything, I'm going to put on my gloves. Okay?
Okay.
First, we're going to inspect Megan's scalp. Her scalp is even. Their color is even throughout. There is no lesions. There's no sense of alopecia. There are no lice. Our hair is evenly distributed. It's brown and blonde in color. Okay? We're going to now palpate the scalp. There are no bumps or malformations. The cranium is even and round. Now we're going to move down to our face. First, we're going to start with palpating our frontal sinuses and then our maxillary sinuses. Megan, let me know if you have any tenderness.
Nope.
Okay. Now we are going to palpate our temporal arteries. Our temporal arteries are 2+ bilaterally. Now we're going to palpate our temporomandibular joint. Megan, if you could clench your teeth for me and open your mouth. Perfect. There is no clicking, no popping, no signs of TMJ. That is cranial nerve 5 intact. Now we're going to move to our facial expressions. If you could smile for me, frown for me, wrinkle your eyebrows, raise your eyebrows, wrinkle your forehead. Perfect. Puff your cheeks out. Perfect. Cranial nerve 7 is intact. Now we're going to move to our eyes. Okay, Megan's eyes are blue. The iris, the sclera is white. Our eyelashes are black. They are evenly distributed. Megan, if you could pull down your lower lids for me and look up. Our conjunctiva is pink and moist. Perfect. We're going to look to the side. Megan's cornea is translucent. No signs of glaucoma or cataracts. Perfect. Okay, Miss Megan, first we are going to assess your pupils for accommodation. If you can look at the ceiling where the curtain meets it, and you're going to look at my finger when you see it. Perfect. Pupils accommodate accordingly. Now we're going to do the 6 cardinal movements of gaze. Okay, you are going to look at my finger and follow it without moving your head. Perfect. Extraocular movements are intact. That is cranial nerves 3, 4, and 6. Next, we're going to do perla as well as assess the size of the pupils. Megan, you just look straight ahead. You're going to see a bright light come from the side. Perfect. Pupils are 3 millimeters. They are equal, round, reactive to light, and accommodation. That is going to be cranial nerve number 3. Okay? 3, 4, and 6 is cardinal movements. 3 is perla. Okay.
Oh, wait, did you do the red thing?
No, not yet. Okay. We're going to use the ophthalmoscope, and we are going to go right eye to right eye. Initiate the red reflex. And on look, perfect. Okay, our eyes look good. There's no drainage, no discoloration, no issues noted in this assessment. Next, we are going to go to our ears. I don't know if my computer is recording or not. Yes, it's still recording. Okay, perfect. All right, we're going to go to our ears. Our ears are symmetrical. They are in line with our eyes. There is no lesions, no discoloration. No obvious signs of physical illness. Now we're going to take our otoscope and we are going to look at our auricle. We are going to pull it up and back and look inside the ear. Our tympanic membrane is pearly gray, translucent, and has no perforations. Next, we're going to do a whisper test for hearing. Okay, so Megan, if you are going to cover one ear and I'm going to whisper into the other ear and cover my mouth, you tell me what I say.
ABC.
Perfect. 1, 2, 2, 3.
1, 2, 3.
Perfect. Okay, that is testing cranial nerve number 8. Additionally, we're going to do the Weber test. This test involves a tuning fork that you're going to whack on something hard and then put on the patient's forehead. You tell me when you feel those equally on each side. Perfect. Okay, now we're going to do the Ryan test. We're also going to whack this on something hard. We're going to place it on the mastoid process. You tell me when you stop feeling that. And when you stop hearing it? Perfect. Okay. Our bone conduction should be half the time of air conduction, or air conduction twice the time of bone conduction, however you want to phrase it. Again, testing hearing is cranial nerve number 8. Next, we're going to move to our nose and our mouth. Our nose is midline. It is symmetrical. There are no obvious bumps, lesions, malformations. There's no drainage. We are first going to test the patency of each nostril. Megan, if you could close one nostril and sniff for me. And the other side. Okay, now we're going to do the same thing and assess your sense of smelling. If you could close your eyes and close one nostril for me. Perfect. Now, if you could tell me, what do you smell? Alcohol. And the other side? Perfect. Cranial nerve 1 is intact. There are no signs of septal deviation in Megan's nose. Now we're going to move to our mouth. Our lips are even, symmetrical, pink in color. No lesions, no discolorations, no drainage. You can open your mouth for me. Perfect. Tongue is pink and moist. The mucosa is pink and moist, and there are no signs of dental caries. Next, we are going to check the movement of the tongue. You can take your tongue and say, ah. Perfect. Uvula is midline. Uvular and tongue movement is adequate. This is cranial nerve 12. Okay. Next, we are going to initiate the gag reflex. If I can have tongue depressor, you can do it. Okay. And gag reflex, and then if you can swallow for me. Perfect. Cranial nerves 9 and 10 are intact. Next, we're going to move on to the neck. The neck is even. It is symmetrical. There are no obvious bumps, malformations, anything like that. We are going to palpate the trachea. Trachea is present. No lumps or malformations. If you could swallow for me. Perfect. Thyroid is present. No lumps or malformations noted. Okay, we are going to use our pen light to check for JVD. If you could turn to one side for me and the other side. There are no signs of jugular vein distension. Okay, next we're going to palpate the carotid artery. Perfect. The carotid artery is 2+ bilaterally. Remember not to palpate these at the same time unless you want your patient to pass out. Next, we are going to auscultate for bruits in the carotid artery. If we hear bruits, it's going to sound like a swishing sound. That is not a good thing. We're going to use the bell of our stethoscope to auscultate for bruits. Okay, no bruits noted. Okay, next we're going to do range of motion of our neck. If you could look forward, look back, to the side, to the other side. We're going to assess the strength of the neck. Push against me. Push against me. Perfect. And we're going to push our shoulders up. Perfect. Cranial nerve 11 is intact. Finally, we are going to go to our lymph nodes. We have our preauricular, postauricular, occipital, posterior cervical, deep cervical, superior cervical, anterior cervical, jugulo-digastric, submandibular, submental, and supraclavicular lymph nodes. Okay? Next, we're going to go to our anterior chest. First, we're going to inspect the anterior chest. It is even. The contour is symmetrical. There are no obvious discolorations or signs of physical illness. We're going to then palpate the chest. You let me know if you have any tenderness, okay? No tenderness? Perfect. Okay, now we are going to auscultate the anterior breath sounds. There are 5 on each side. We're going to use the diaphragm of our stethoscope. They should be clear to auscultation on each side. We're going to go in a diagonal movement to make sure that they sound the same on each side. And again, we're using the diaphragm of our stethoscope. Perfect. Bilaterally clear to auscultation. Now we're going to move on to our posterior chest. Okay, our posterior chest we're also going to inspect. There's no discoloration. It's symmetrical. There are no obvious signs of physical illness or malformations. Now we're going to palpate. Tell me if you have any tenderness, Megan. Nope. Perfect. Okay, now we are going to auscultate our posterior breath sounds. There are 18 sounds, 9 on each side. We're going to use the diaphragm of our stethoscope to listen to these, and they should be clear and equal on both sides. Perfect. Clear to auscultation on each side. Next, we're going to assess for bronchophony. And this, you're going to state 99 each time that you feel the stethoscope. In real life, we would do this 18 times, but for the sake of time, we're just going to do 5 or 6.
99.
Perfect. The 99 should sound muffled and indistinct. Now we're going to test for whispered pectroliloquy. In this, you're going to whisper 99 each time you feel the stethoscope. Megan? Perfect. Again, this should sound indistinct and muffled. Finally, we're going to test for egophony. You're going to say E each time you feel my stethoscope. It should sound like E, not A or A. And just a reminder, we are going to assess each of these in all 18 places, but for the sake of time, we're just doing 6 in this video. Okay, our posterior chest is wonderful. We have finished our respiratory component of our chest and are now going to move to the cardiovascular component. First, we are going to palpate for thrills or pulsations in each point. This is aortic, pulmonic, Erb's point, tricuspid, and mitral. There are no thrills or pulsations noted. Remember not to use your thumb because you have a pulse in your thumb. Okay. Next, we're going to auscultate at each point. We're going to start with the diaphragm of the stethoscope at the aortic, pulmonic, Erb's point, mitral, or tricuspid, and mitral. Then we are going to move to the bell of the stethoscope and do the same thing. Aortic, pulmonic, Erb's point, tricuspid, and mitral. There are no bruits or murmurs noted. Finally, we're going to move to the pulse points of the body. Megan, if you wouldn't mind laying down for me. Now, we would assess these pulse points bilaterally, but for the sake of this video, we're just going to do it on one side. Okay? We've got our radial, ulnar, brachial, carotid. We will come back to our apical pulse, our femoral, our popliteal, our anterior tibial on this little bump in your ankle, and then our dorsalis pedis by your big toe. Okay? All pulses are 2+ bilaterally and strong. Again, you would assess both sides, but for the sake of this, we're doing 1. Now we're going to listen to our apical pulse. This is at the 5th intercostal space in the mid-clavicular line. We're going to use the diaphragm of our stethoscope. We're going to auscultate for 1 full minute. Ding! It's been a minute. Our apical pulse is normally between 60 and 100 beats per minute. Megan's is a healthy 72 beats per minute. Okay. We've assessed our cardiovascular aspect of our patient. Now we're going to move to abdominal. Remember, for abdominal, we're always going to inspect and auscultate before palpating so that we do not move any gases throughout the bowels. So first we're going to inspect. Our stomach is flat and contour. It is symmetrical. No distension, no swelling. Now we are going to auscultate the stomach. We're going to listen for vowel sounds. We're going to start in the right lower quadrant. We're going to use the diaphragm of our stethoscope. Right lower, right upper, left upper, right lower. We would auscultate each of these quadrants for 1 full minute, and we would hear 5 to 30 vowel sounds per minute. Below 5 is hypoactive, above 30 is hyperactive. If you hear nothing, these sounds are absent. You're going to listen for 5 full minutes to confirm this finding. Okay? After we've auscultated the abdomen, we are going to palpate the abdomen. We're going to start with light palpation. Again, anytime you palpate, ask the patient to tell you about tenderness. Let me know if you have any tenderness. Lightly palpate each quadrant, and then deeply palpate each quadrant. Finally, we are going to percuss the abdomen in a diagonal pattern. You should hear tympany, which sounds like air in the abdomen. If you hear dullness, then that means that there is a mass or an organ obstructing that area. Okay, after we've percussed our abdomen, we are going to move on to our musculoskeletal. We've already said that our posture is erect, and we will save our range of motion of the spine until the patient stands up. So we will start with our hands. Rewind. We're going to go back to abdominal bruits. When we auscultate, we should go ahead and do these bruits. So we're going to listen to with the bell of our stethoscope, our abdominal aorta, our renal, and our iliac. No bruits noted. Again, that would be a swishing sound. Okay. Now we're going to fast forward back to our musculoskeletal. Posture is erect. We will assess our spinal range of motion momentarily. Okay. We're going to to start with our hands. If you could grip my hands for me. Perfect. Okay. Turgor of our skin is good, or elasticity. Capillary refill is less than 3 seconds. Hands are nice and warm. No signs of nail clubbing. Now we're going to do the range of motion of your hands. If you could just twirl your wrists for me, pinch your fingers. Perfect. We're going to do the passive range of motion of your elbow. Okay. Perfect. All right, we're going to do passive range of motion of your shoulder. We're going to come out. We're going to come in front. And we're going to come all the way up. Perfect. Now can you do your shoulders in a circle for me? Perfect. We've got nice range of motion in our shoulders. We're also going to assess the strength of our upper extremities. If you could push out against me, pull in towards me, push up against me, and that is cranial nerve 11. Intact. Strength and range of motion of upper extremities have been established. Now we're going to move to our lower extremities. We are going to assess for temperature. They are nice and warm. Our capillary refill on our toes is less than 3 seconds. We have a nice strong pedal pulse. There is no edema or swelling in either extremity, the hands or our feet. Our turgor is good. We're going to test the range of motion of our feet and our ankles. If you could do your feet in circles. If you could clench your toes for me. Okay, you're going to push against me. Push against me. Perfect. Range of motion and strength in the feet have been established. Now we're going to do range of motion in our knee. We're going to come up and then back down. Perfect. Range of motion in the knee has been established. Now we're going to do range of motion in the hips. We're going to come out and back in. Out, back in. Perfect. Range of motion in the hips has been established. And you're going to push out against me. Pull in against me. Perfect. Okay. Strength and range of motion in the lower limbs has been established. We're going to check our femoral lymph nodes. There's no inflammation and no obvious nodules. Our musculoskeletal assessment for the lower limbs is completed. Now we're going to move to neurological as well as the range of motion of the spine. So for this, we are going to have our patient stand up and move so you can see her. All right, Miss Megan, can you stand up for me? Let's start with our range of motion of the spine. Lean back, lean forward, to the side, to the other side. We got nice range of motion in our spine. Perfect. We will go ahead and do our Romberg test. We're going to stick our feet together. We are going to close our eyes. We're going to stick our hands around us. We would do this for a full 20 seconds. We're going to assess if our patient is wobbly and falling over. Megan is good. This is cranial nerve number 8. Okay. Next, we're going to test our gait. Since we're already standing, you're going to walk heel to toe to me, Megan. Perfect. And turn around and walk on your heels. Perfect. Turn around and walk on your tiptoes. Perfect. Gait is steady. You can go ahead and take a seat for me, Megan. All right. We are going to test the cerebellar function of our upper extremities and move this so you can see us. Okay. First, we are going to take our finger to our nose. Perfect. And bring it out to my finger. Perfect. Do it on the other side for me. Finger to nose, finger to finger. Come on back. Perfect. Okay. Then we're going to do our fingers to our thumbs. And then back. Perfect. Cerebellar function of the upper extremities has been established. You can lay back down for me, Miss Meg. We are going to do cerebellar functioning of the lower extremities. You're going to take your right heel up against your left shin for me. Perfect. And your left heel up against your right shin. Perfect. Cerebellar functioning of the lower extremities has been established. While she's laying down, we're going to go ahead and do our abdominal reflex before we make her sit back up. Perfect. Abdominal reflex is normal. All right. The next part of our assessment, we're going to go ahead and do the pain and sensation, since Miss Megan is already laying down for us. Okay, you are going to tell me if this is sharp or dull. Okay, you close your eyes, you tell me. Sharp. Perfect. Sensation is intact. Now we're going to do 2 points of distinguishing. You're going to tell me if you feel 2 points or 1. 2. Okay, we would measure this distance between the 2 points. Okay. Finally, we're going to test your reflex. If you wouldn't mind sitting up for me, Miss Megan. All right, and we are going to start with our biceps. We're going to kind of cradle our arm here, and we have a bicep reflex, and then we're going to cradle our arm here. We have a triceps. Okay. We have a triceps reflex. Perfect. We're going to go to our brachioradialis reflex. Perfect. Okay. We've already done our abdominal. We're going to go to patellar. Perfect. Her reflexes are slightly jumpy, and the left patella and the right patella. We're going to go to our Achilles. Perfect. We're going to go to our plantar. Just run the reflex hammer up the foot. We're going to go to our Babinski's. We're going to do an upside down J across the foot. It is negative Babinski's response. This should only be present in infants, and their toes will flail out as you do this motion. Our patient is nice and healthy and should not be in the hospital. Thanks, Megan.
You did good.
You did good.
Did I miss anything?